In the city of New Orleans, the health department has developed a division to deal with the fentanyl crisis.
Yeah, I spoke with the director of that division who pointed to the alarming facts of how the drug is affecting our community.
Last year in New Orleans, we lost 523 individuals to accidental drug-related deaths. 86% of those tested positive for fentanyl. So we do know that the majority of the people who are dying from drug overdose at least have fentanyl in their system.
That's almost 2 people per day, correct?
That's right, yeah. And we've seen, unfortunately, a pretty steady increase over the last few years in terms of our drug-related deaths in the parish.
Dana Wilkos is the Opioid Special Projects Coordinator for the New Orleans Health Department, and she's painting the picture of the effects of the drug on our community.
Who's most affected?
So last year, 75% of the individuals who died were male. 56% of them were Black. So we know it's mostly Black males.
Wow, that's who's being affected in New Orleans.
In New Orleans, yes. And we have seen across the country a pretty significant increase in drug overdose deaths among people of color. They are impacted more substantially, but we've also seen a really rapid rise in deaths amongst people of color.
For that reason, Orleans coroner Dr. Dwight McKenna has spoken up since he's been in office, witnessing how many residents have landed in the city's morgue.
We're sounding the alarm to parents, to young people, to everybody who will listen, to tell you about the dangers of this drug. We've never seen anything like this deadly opioid.
What's even more dangerous and frightening is that the drug is being combined with other drugs and the user unknowingly ingests fentanyl.
That could be some type of pill that is marketed as another opioid, so say a Percocet, but there's fentanyl in it. We're even hearing of instances where amphetamines like cocaine or methamphetamines are having trace amounts of fentanyl in there, which is especially dangerous if somebody hasn't built up a tolerance to fentanyl and they come into contact with that.
The health department has sprung into action with a number of initiatives making the drug Narcan readily available to combat overdose and training workspaces and individuals on helping out.
We have our Narcan training programs, overdose response programs. We also, the New Orleans EMS has partnered with Odyssey House, Louisiana to dispatch quick response teams to the scene of an overdose. Those are comprised of social workers, so it's an effort to get to that person right away, to try to provide support to them, whatever kind of resources they might need. We are also partnering, the New Orleans Health Department is partnering with the DA's office to form an overdose fatality review team. That's in the very early stages. We're hoping to start that early next year, but that's going to give us a little bit more insight as to the people who we are losing in Orleans Parish. We have this very basic demographic data, but we don't know much about whether they've been incarcerated, how many times they've been in treatment, so this will allow us to do deep dives on individuals who have passed.
As for the living, Coroner McKenna has a warning.
Young people, if you're going to use drugs, and I don't want you to use drugs, but if you've made the decision, you better be doggone sure that what you're buying or what you're doing has not been mixed with fentanyl, or you're not going to wake up.
For resources from the city's health department, head to NOLA.gov/opioids.